In 2006, when I got my first pet, Phoebe, a golden retriever. Now, we want the best for them. And everybody started telling us that you have to give non-veg to her for her protein requirements. And I said, yeah. And my mind was, the more I give her, the more good it is for her. And I started giving her chicken twice a day. And one night, suddenly, she started vomiting. And this was middle of the night. And I had no clue what was happening. And it was probably one of the scariest days of my life. But today, we have Dr. Pawan Kumar with us, who is a renowned pet practitioner and a founder of Cessna Life Veterinary Hospital chain, which is across 4 states, practicing since last 22 years, who will help us to understand the importance of digestive health in pets. Thank you, sir, for being here.
Thank you.
We have a few questions, and please shed light. And for all of us who are first-time pet parents, and also the ones who, like me, have been a parent once and who are again in the zone of buying one more pet. So, what are the signs of healthy digestive systems when it comes to cats and dogs?
Yes, so when we talk about a healthy digestive system in dogs and cats, first of all, the healthy digestive system is of utmost importance actually for a good quality of life and for overall well-being of a pet actually. When we think about what are the signs which a client can actually understand that his pet or her pet is actually in a good health stage, particularly for the digestive system. These are, one of them is very important, whether the pet is having a steady appetite, and this a pet parent can very well check because he is observing everyday basis. He can understand whether he is overeating or he is undereating. That's something I'm sure any client can understand that part, whether he is eating more or less. And so he should have a very steady appetite. Second thing which is very important, whether a pet parent, whether the digestive system is in a good health stage or not, is the weight, whether it's a normal weight the pet is having actually that, which we normally check by body condition scoring, whether he's overweight or he's underweight. And third things, whether the pet is actually having adequate water intake, and that's something can be observed, another thing. And another thing is whether pet is free from any kind of digestive disturbances like, bloating or pain or whining or getting any kind of common gut issues actually. So these are the certain things which I can tell you, very important sign any pet parent can understand.
Any behavioral changes when digestive health is affected? So for us to observe and say.
Yeah, absolutely. What you're asking is a very important question. This works quite a bit in the cases of pet parent of cat. Like dogs have a different kind of digestive disorders when they have, and they show kind of different kind of sign. Particularly in case of cat, when they are having digestive disorder, they start showing more of behavioral signs actually.
Okay.
Like they started showing the behavior sign of, like isolation behavior, secluded behavior, not interacting too much. And another thing is in cat, quite common observed is even the some cat becomes very irritable actually, that when you start playing and other things. So these are more often seen in the cat than the dog actually. So very important questions, particularly for the cat pet parents actually.
And for dogs also, something specific that we could look at?
If you ask in a more medical way, which I'll tell you, that there is a very important chemical in body which is produced, we call it serotonin, which is for human as well as for the dog. It is produced by the intestine. And serotonin is the number one chemical which maintains the good behavior of human as well as the animal actually.
Okay.
When you have a digestive disorder, then you will have a behavioral disorder also. It's a direct correlation. And you can understand from the human also, many people who have gut issues, almost you can ascertain that they will have behavioral issues. Same thing applies with the dogs and cats.
Okay, so they would be irritated.
Absolutely. Sometimes anxiety, sometimes stress, which goes, sometimes fear becomes too much actually, that they start passing urine frequently, they get fearful. Of course, like a reaction to, kind of normal stimuli will be much more than usual actually. So there's lots of behavioral change.
So let's move on to the next question.
Absolutely.
So what are the common causes of digestive disorders in pets, cats, dogs?
So there are various causes, and if I try to kind of, categorize in two things, one can be dietary cause and another which is medical cause. So when we talk about the diet, which plays a very important role, so particularly when we think about the diet, what are the which are diet related cause can be there. So you might have seen many clients abruptly they change the diet actually, like for example you are having a party, maybe Diwali or Christmas or anything, and suddenly you started giving like cake today. After 2 days, you'll find your Rottweiler or your German Shepherd will have blood mixed diarrhea and everything will start. And this is a very common problem which happens because they are not as acclimatized as like human actually. So they are very much more balanced, need to be in digestive system. So abrupt change in food can be one big cause. Then comes about is poor quality of food. Like the diet what we are giving is that is deficient in some nutrition actually. So that's another things which can lead to kind of nutritional deficiency and behavioral problems also. Then comes about overeating. So sometime food they started eating more. So then of course it goes to metabolic disorder.
It happens with pets also.
Absolutely.
Even pets tend to overeat.
Yeah, absolutely. So there are some breed which are scientifically proved that they have some kind of genes which are like Labrador Retriever and Golden Retriever, that they have gene for the food appetite more than that other breeds.
And that's why you can see a lot of Labradors being
absolutely obese.
Yeah.
So so indirectly they become obese and overweight actually. That
which is very, very different, right? Otherwise, the animal starts eating, and then stops when they're full.
Yeah. Nature
overeating is a very
very true.
Very okay.
Yeah. Then other things, when I talk about the other cause for the kind of where that digestive disorders can happen, is like there are medical cause, like sometimes bacterial infection, viral infection, parasitic infection can happen. There's another very important thing which I think pet parents should know, that as the age advances, after 8 years they call as senior, after 10-12 years we call them as geriatric actually.
Okay.
So with the age, what happens, like so the requirement of the diet and digestive system, it goes in a different way. So the metabolism slows down, enzymatic activity slows down, so that digestive system has overload if you give the same kind of diet. So then they will have more issues. You might have seen many senior dogs, they will have more constipation problem, and this happens because client has not understood the nutrition very well actually. That
so I wanted to break this down.
Sorry,
I'm going a little bit off topic, but to everybody who's out there who's a pet parent, I want this to be like a guidebook for them. Where let's say I have a puppy, yes, and for the first 6 months, what is the kind of food I should introduce to the puppy? Because I've just got the puppy is 3 months old and everything.
Yeah, I think it's a very important questions, and this is particularly for the new pet parent. And I think if I put it, the life is shaped in the initial 5 months.
Okay.
Life for the pet is shaped in the initial 5 months. So the 5 months, the kind of nutrition what you give, it shapes. That's for the dog as well for the cats actually. The required.
This is scientifically.
It's a scientifically proved thing.
Oh, okay.
It's a very, very important thing. The development of the brain, the development of different organs, the structure, the kind of the muscular structure, the different organs development. So it's a very, very important. There's a maximum 70% growth happens within 5 months actually. That so it's an integral part of that, and nutrition plays a huge role in that. So when I talk about so most of the pet parents, they buy puppy, they keep giving food exactly as human is giving, and after by the time they realize it's 5 months already over, so they have lost that window period where they could have done remarkable change. So during that time, giving a quality balanced diet is of utmost importance. The protein requirement of them is almost much higher than what human has actually. That
okay.
The requirement of B complex what they have is, and minerals what they have, is almost 5 to 6 times than human being. So what happens, so having a really good nutritional plan is very important during that time, and this applies for the kitten as well as for the dog both. Cat, if you say that they ideally need to be, they are by nature they are carnivorous. Evolutionary that's how they have developed actually.
Correct.
And we keep giving them milk. It's not the food. Of course, they can survive, they can be alive, but that's not the quality of life.
So Billy doodh pee jati hai.
Haan.
Is it like a myth? They don't need milk?
Yeah, absolutely, they don't need milk actually. That it's a myth.
This is
yeah,
something.
Absolutely.
I wasn't aware of this.
Yeah, it's a very important.
For dogs, I had done that, but for cats, I've always seen people. Moving on to the next question.
Go ahead.
So, what are the common symptoms when it comes to digestive disorders with cats, dogs?
Yeah. So I think about this question, one thing, Karan, I like to tell you that when we talk about digestive disorder symptom, for a pet parent, it is actually very important to know this, because sometimes the good knowledge of these indicators actually can save quite a bit of their money. Number one symptom you'll find, like, kind of, which is most common, is vomiting. And vomiting itself, there are further categorizations, whether vomiting started acute vomiting, like abruptly started, or it is happening intermittent vomiting, like after 2-3 days, once in a week, once in 3 days, like that. At the same time, the color of vomiting, the variety of vomiting, that also is very important to note down.
Can you just explain this a little bit?
Let's say that some patient is vomiting once in a week, actually. In a cat, for example, they are doing it. So what basically it indicates, it doesn't look like infectious problem then. It means it's something related to either indigestion, or it is food allergy, or sometimes they have another conditions like a hairball formation. They keep eating and keep licking their own fur, which get rolled inside and becomes a ball, and they can keep kind of vomiting it out. So that can be like simple thing which I'm telling you that. So that's one symptom, so vomiting, and the variety of vomiting and further differentiation of that. Then comes about diarrhea, like, which is again in diarrhea also there is a variety further, whether it's a intermittent diarrhea, it's a chronic diarrhea, it's acute diarrhea, it is blood mixed diarrhea, like whether it's a the diarrhea which is there, let's say it has a color of, let's say, terry color, or like a black color. Indirectly it is telling that it is some bleeding is happening in the small intestine or in the stomach somewhere. It can be sometime diarrhea which can be like a gray color or pale color, which can tell about pancreatic disease or about liver disease. And sometimes it can be blood mixed. Directly it can tell there's a bleeding happening somewhere.
Oh my God, I was never aware of these many things that we could, and these are absolutely basic things, right?
Very simple thing, but you just need to observe it.
Correct.
Actually,
correct.
Then apart from that, when I talk about some other kind of symptoms which a pet parent can be aware of, like for example, weight loss. Like the pet is, whether it is increasing the weight or it is kind of decreasing weight. So that's also one sign.
Can you tell me how much percentage should I get worried about? Let's say if the pet is at 30 kgs.
Yes, that's right.
So then should I be worried if it goes to 27, or should I be worried if it's like 20% lesser? Or
yeah, I think if I put it like, if see more than this one, that so first thing is the pet is otherwise is a very bright, active, responsive. And then there is a very slow weight loss, let's say like a variation of 5% or 7%. I wouldn't say so much to worry for that. But you find if it is going more than 10%, you should worry for that, whether it is upper side or it's a lower side. We call in this case is a body condition scoring. Out of 9 we score. If they are stays between 4 to 5, then that's excellent. But if they are less than 4 to 5 score, and if it is more than 5 score, then there is some concern. But any pet parent should be aware about the body condition score, and they can very well know how to calculate that actually. But just by touching the rib cage, understanding from the different angle the pet, whether he's in what body condition score he falls up actually. And that's something will tell whether he's overweight or he's underweight. See, simple one learning can tell them whether my pet is obese, overweight, underweight, or emaciated actually. That so they can come to know about that part. So it's a quite important simple learning, which is very nice learning they can do. I think you're asking the question about the symptoms which you're telling. Other symptom which I can tell that so about the gut issues, something like bloating happens, stomach is bloating, sometimes pain. And the pain, how the dog or cat, they show sometimes like in a praying posture. The front portion is down and the back portion is up, which also tells sometimes pancreatic disease or upper GI disorders actually there. And then apart from that, even the stool that formation, or the we say the quality of stool, that also changes. It can become really very hard, or it can become very very soft to you, like very watery, another thing. So those are also symptoms comes. So these are the some symptoms which I can kind of tell you, which are very very important. The client or pet parent should be aware of actually that.
So the next question is how to diagnose digestive disorders. Like as a vet, what would you do?
Yeah, so like the way body systems has been made actually. So every system has a different approach to diagnose. Like it's a very detective kind of job, like Sherlock Holmes kind of job actually. And there's a multiple clue we have to get it for that. And as I mentioned, actually the symptoms or digestive symptoms which pet is showing, those indicators are very important. So digestive disorder history, which is very very important, and history taking, and what kind of symptoms the patient is showing, because dog and cat is not going to speak, so client has to tell for that part. So we need to know the history, very important. And I can give one thing to the pet parent, in my opinion. Whenever before going to a vet visit, it is, if they want a productive vet visit, it is important those old symptoms better they write down on the piece of paper, because sometimes they'll forget when they'll go to that.
Correct.
And those are so important for diagnosis of the kind of this digestive disorder. So this is one thing which I can tell you, and it really makes a difference in the quality of life and diagnosis also. So the history is one thing. Then comes about physical examinations, which depend upon the expertise of the doctor. And so there is a specific way we check the stomach, different vitals, different body structure we check, and we kind of find some indicators, and then we make kind of further diagnosis. Then we take help of some laboratory diagnostic like blood test, biochemistry, or urine samples and fecal test and other things actually. So that's also helps in that part. Then comes about for specific thing we take about X-ray. Let's say that constipation we want to diagnose, or foreign body obstruction we want to diagnose, or liver disorders or something. So in those cases, X-ray, ultrasound, these becomes very important actually. Then for some specific conditions, the advanced diagnostic is required. Let's say the endoscopy, biopsy. So those are like directly you are going into the organ, into the gut, and then you are trying to check, what it is there, like tumor, parasite, chronic ulcers, those kind of things. We check that. And biopsy mostly for cancer patient we advise. So these are some diagnostic modalities. Another thing comes about specific diagnostic. There are specific digestive disorder like pancreatic disorder. There is a small intestinal bacterial overgrowth syndrome, we call it. Is for that there is a different marker we do the analysis. And these are kind of common things which we use for diagnosis. Last very important thing is the food trial. That's also used for diagnosis of that. So these are the common things which are used for diagnosis.
Generally, we say prevention is better than cure.
Absolutely.
Right? Would you advise, like, I feel very stupid right now saying this, but I did not do this. But would you advise pet parents to, have something like a yearly test or something, diagnosis done for the pet's digestive health? Is some advice, something that they should do?
Yeah, I think
Once a year or maybe once a
see, there are 2-3 aspects comes about that. One is the pet is overall healthy. It is advisable once in a 6 month it should be checked by a vet, because you may not know many things which vet eyes can detect it actually. That's why he's a vet actually.
Okay.
Okay. Once in 6 months, irrespective of that, if you are a good pet parent, I can give you one simple things to you, and I think that explains quite a bit of thing. A good preventative health care and a great nutritional plan. If you follow on those things, like with the regular vet health check, you can extend the life of a dog by 25%. Can you imagine 25%? No, it is percentage wise, it's okay. It is not the growth of an organization. 25% increase in the life I'm talking.
We are talking 2.5, 3 years possibly.
Yeah, we have seen many pet parents, the pet is diagnosed with a cancer, and some cancer which are not curable. And what the client will say, they will spend huge money for that. They say, can you extend life 6 months? Okay. And you understand what I'm saying? I'm comparing with that context. Correct. To this context, preventative health care. So if you focus from the starting on preventative health care and nutrition, 25% life increase. 12 years dog is 16 years old dog.
Which is, I think so, what you mentioned earlier, that first 5 months.
Yeah.
That is something I don't know how, but I've never seen somebody speak about this also.
Absolutely.
And those first 5 months is like 70-80% of the problems you can take care of. And then, of course, it's preventive and, regular checkups.
Absolutely.
And everything. So is there any tool available in the market for pet parents to, just go and buy it over the counter and check the digestive health of their pets?
I liked your question, that way you mentioned that in the market. The one very important tool which we already have for a pet parent is, which nature has given, is the eyes actually. That's the most important tool, if I put it, for a pet parent, if they really want to kind of, the tool they really want to use it, whether the pet digestive health is normal or not. So the reason I'm kind of telling it, because when I'll explain, you'll understand more. One is the eye, which I'll put it on priority. Second thing, which is the body condition score, which I spoken before also. The body condition score is something which a pet parent can learn very well. It's a very simple, very easy. Everyone, when they have learned how to use what, they can learn how to get the body condition scoring. It's a very easy to understand, but it's a really simple, remarkable thing if a pet parent can do that. And third thing comes about is fecal scoring chart.
Okay.
That's another very important thing. They are eating food and they are pooping out, but they can score that actually, because I'm sure that dog is pooping somewhere. Human definitely don't score his own poop, but they can score that part. So everyone takes the dog outside for walk.
Correct.
And every cat goes to a litter. So these are the places where they go. I'm sure they, if they are sensible pet parent, I'm sure they're scooping it, putting it into dustbin.
Yes.
And this is a simple observation they can do. So and checking it,
correct,
using it that actually. So this is something which I talk about is body condition score and fecal score. So fecal score, normally we do it between 1 to 7 actually. So 1 is hard, 2, 3 is normal normally, and 4, 5 becomes more soft, and 6, 7 becomes diarrhea or watery actually. That's how it goes scoring. So if this is one thing, they can do it. And I personally feel if they really want to maintain a better thing, on their fridge actually, they can have one chart which is like for a full month, they put it on days wise.
and they're just scoring.
They score 1, 2, 3.
4.
Yeah,
correct.
absolutely.
And the most number of days that they get between 1 and 3,
Yes,
or maybe 2 and 3.
Yes,
is
absolutely.
Is the great
if it is exactly like 2 to 3 is there, then it's fine. Then even they can see the pattern. They can see the pattern happening like in the whole month. Like it is becoming 4, 5, 5, 6 more. Particular days it is happening more. They themselves can understand what pattern, like Saturday it is happening more. It means Friday they are doing something abnormal actually.
Correct.
You understand? Like you can see the pattern actually, that part. Are they feeding something unusual on Friday?
Correct.
So this is something they themselves can analyze that.
Or even that, they could understand that last month, these 2 days, we had a house party, for example.
Absolutely, yeah.
Yeah, and there was leftover food, and
Yes.
somebody,
Yes.
we avoid, but there were so many guests and somebody would have given it.
Yes.
And next day, ये problem hai.
Yes.
So, and because I'm stool can't lie.
Absolutely.
That is
That's the
impossible,
result,
right?
yeah.
That's like,
So that's what, yeah, absolutely. It's result will come, and result is of what you are feeding it actually,
Correct.
and how your pet is doing. So fecal scoring is a very good output result, and you can just see it. And it's a really good chart. You can take it to the vet also. Vet will be, kind of surprised that you are such an amazing.
Very happy, right?
Yeah. So that's something is like so careful pet parent. Another thing, body condition score and eyes, which I told you. So these are some tools which are very important.
But nothing available over the counter, right?
Not required also.
Not required also.
Yes.
If such basic things are taken care of,
absolutely, that.
then
there's more than enough.
Because then you're unnecessarily trying to become a vet, probably.
Absolutely. Yes. Chat, GPT, Google, all will go. I think if they can do it, the vet can do a wonderful job for you.
So how as a pet parent, I should look at dietary management or something, so that my pet does not suffer from these disorders.
Yeah.
And which could, like you, oh my God, that 25%. And I'm sure that if you're a pet parent, you understand that value of that 25%.
Absolutely.
Yeah, so what can we do?
Yeah, so when you talk about dietary management, so when when we started studying the medicine actually, the first medicine is diet or nutrition actually. Like after that, your all drugs, antibiotic, everything comes actually. The number one medicine is for a pet is the diet actually, or the nutrition what you are giving it. So structuring that is very important. Otherwise, there are really good companies like even Royal Canin and other companies which are really making wonderful diet actually, that, and which are structured as per the breeds also, and which are structured even as per the conditions. Like you've spoken about digestive disorder. So they have certain diet, like Royal Canin has, kind of gastrointestinal pack for the, high calorie or high energy diet, or for the GI issues they have diet. And some diet which are like now for food allergies also, like which works wonderful actually, that part which can be used. So those can actually, not only that, those are diet, those actually can become a cure also. Like that's important. So you're treating the patient by the diet itself. So then what more you want? There's no medicines to be given and nothing else to be done. You can cure by that. So dietary management is a very essential part, if I say for that.
Anything else you want to encapsulate all that we've spoken about in 4 or 5 points?
I think that I wish I can have a full day lecture on that. But if I ask him for the 4 points, the number one thing which I will kind of advise you that if they can focus on the, kind of nutrition and, like a well-balanced diet, and that is the number one priority a pet parent should give it, should not underestimate the power of diet and nutrition, actually. That this is something I would request. And as I mentioned in the first 5 months, it's a very important thing. So that's number one thing. Second thing which I will advise you, that they can learn the body condition scoring as a tip. And second thing is the kind of the stool or the fecal scoring, the chart system.
Correct.
That's another tip which I'll give. It will tell you how is my pet doing, whether he's eating well, and how is the output happening. That's the second tip is I can tell you. And third is the water, whether they are having ample adequate water or not, actually, that part. So the intake of water is another tip. I'm telling you just simple observation.
Correct.
So, and you're not doing anything for that part. So that's another thing. And fourth thing, if you ask from a veterinary perspective, like a parasite control and a regular vet visit, that's like once in 6 months at least. So I think if you put in 4 points, these are the 4 points I can tell you.
Thank you. Thank you so much for your time. Really appreciate this. And to each one of you out there, let's become a better pet parent. And that is what we are all about. Please do like, comment, subscribe the Royal Canin YouTube India channel. And please share it with at least one person. You never know who may need it. Take care. Bye-bye. See you in the next podcast.